Hello, Berry Nation. Happy Monday. Welcome to Talk with a Doc. Dr. Chen is going to be joining me live for a 30-minute Q&A session. This is your opportunity to ask your bariatric, your weight loss surgery related questions to an expert in the field. And Dr. Chen is one of our amazing practice partners. He's an expert partner of Berry Nation, and we are just so thankful to have his time today. There are two great questions that have already come in. Hi, Jonathan. Hi, guys. Hi, happy Monday. Hi, everybody. Hello. Oh, some familiar faces, some new names and faces. Hi, guys. Welcome. Welcome. Dr. Chen will be jumping on here shortly. So this is a wonderful opportunity for you guys to ask a question. If there's something that you've been kicking around for a while and you haven't been able to find an answer, or you're a little bit nervous to maybe ask your own medical provider, this is a great educational opportunity for you to ask your question live with Dr. Chen. So if you do have a question, you guys go 2 icons over. So, or maybe it's 1 icon over on yours. It's the question mark bubble. Go ahead and hit that question mark, type your question in that box, and then we can bring it up live on screen. Sometimes if you put things in the chat, we miss it, and we absolutely do not want to do that. So, and it'll be a good one, guys. It's going to be good. And I feel like it's been forever since I've been live with Dr. Chen or Dr. Joe. So happy to be back.
Hey, how you doing?
I'm so good. I was just telling him, it feels like forever since I've seen you, hung out with you, said hello to you. So hi.
Hey, good to see you again. It actually does. I don't know why. I think the spring is really busy or something like that. But it does feel like forever. But at the same time, it's like no time has ever gone by.
Bingo. That's how you know. That's how you know somebody. Oh, wonderful. Well, Dr. Chen, thank you for taking the time out of your very busy day to spend some time with us. Will you introduce yourself for anybody who's watching and has not had the pleasure of meeting you
Yeah,
yet?
awesome. Dr. Chen, my partner is Dr. Cribbins. We're your resident bariatric surgeons here in this wonderful city of Dallas. We are amazing Berry Nation supporters. We've been with you guys for a long time now. And we absolutely love everything that you do for our patients. And so I'm just happy to be here sharing some of our experiences, helping answer any questions. This is a great spot for that.
It is. It's a wonderful spot for that. So like I was saying earlier, Dr. Chen, what I encouraged is, right, if you have a question, you've been kicking around up here, and maybe you're a little bit nervous to ask somebody because I don't know, sometimes right, we don't want to ask questions because we don't want it to be weird, or we don't want to appear like we don't know. But this is kind of a really safe place for you to do that. You can ask your questions. I will ask them to Dr. Chen. He can answer them. It's just a really great way to kind of figure out where you want to go with that information, if that makes sense. So if you have a question for the amazing Dr. Chen, drop them in that question mark bubble icon. So not in the comments, because sometimes they go really quick and we miss them, and I absolutely don't want to do that. Go 1 icon over, put them in that question mark bubble, drop them there, and then I can see them and we can bring them live up on screen. So we have we have 2 questions that came in before, and I just had a question that just came in. So I am very excited to start with this one. So this is a person who we've known for a long time and recently has been sharing this struggle. And I thought it's a struggle that many people in this community go through. So the question, what would you tell someone who has only lost 40 pounds in their first 15 months post RNY?
I think you did the right thing first, is that we would never say only, right? I think we need to celebrate this person's journey, celebrate even the fact that you've had a Roux-en-Y gastric bypass, that you decided to take this, to treat this disease of obesity. I think that is a huge step. And I want to make sure that this person sort of acknowledges that huge momentous decision to treat their disease. And so there's no only here. Of course, this person, I'm sure, is a little frustrated. 40 pounds of weight loss is probably not what they've been expecting at this point of their journey. Weight is also just a number, not the only thing that we're tracking, though it is an important thing. It's not the only thing that we're tracking. When we're a little bit disappointed in terms of our weight loss journey so far, we sort of look at this as a disease process, right? Everyone's metabolism is different. We can't compare ourselves with other people's metabolisms. Everyone's going to respond a little bit differently to our surgery. This person might have a very, their specific changes to metabolism might just have proven to be particularly resistant to their gastric bypass. So of course we can make sure that we are doing everything that we need to do. And I'm sure this person is focused on the protein, focused on moving around as much as possible, focused on everything that Berry Nation can help that person with in terms of support network. And if all those things are still not getting us to where we need to be, we're still dealing with potentially some diabetes or other comorbidities in addition to the the weight loss. We can try maybe adding some GLP-1 medications at this time. I think that would be a worthwhile thing. The Wegovy's, Ozempics, the things like that. That would be the first thing the first therapy that I'll be talking about at this point.
Yeah. Yep. And I just pinned somebody's comment. Thank you, Debbie, for saying that, right? Don't give up. It is frustrating when your expectation is a weight loss number and it's not met, right? I mean, we see people on social media, they're losing, 80, 90, 100, 200 pounds, right? Everybody's celebrating these huge weight loss milestones. And sometimes they just don't come. And I'm so thankful for what you said, Dr. Chen. It's a disease. It's going to require multiple modalities of treatment, right? Some people's disease responds really well to surgery, right? And then when you stack on all those other things that we have to do, right? That very good day checklist, the movement, the mindset, the metabolic wellness, the community, right? It can respond to those things, but your type of disease, how it impacts you is going to be different because you are an individual and your disease is individualized for you. So now might be that time to have that conversation with your provider and say, I'm a little bit frustrated. I was hoping for more. A very valid conversation to have with somebody.
And we also have to acknowledge too where we started off, right? So I don't know where this person's starting off weight is. I mean, if we're saying we were 205 and we lost 40 pounds, actually that's excellent, right? Because I also don't want people to focus on a specific number. You hear all these Instagram stories losing 80, 90, 100 pounds. But what's really important is the percentage of excess body weight off or percentage of total body weight, however you want to calculate it. It's a percentage that is the most important because that takes into account where we started off.
And there are plenty of other data points that we could use when we think about our success as patients. Weight is just one data point, right? It can be the size of our clothes. It can be reduction in A1C. Maybe you had sleep apnea and you don't have that anymore, right? So to take a step back and look at your entire health picture can be really, helpful and motivating and inspiring because it helps you take the pressure off the weight and it puts the focus more on holistic health, which is really what this is all about. It's about becoming metabolically well, not just weighing a certain number on the scale.
Absolutely.
Yeah.
Absolutely.
So thank you very much, friend, for posting this question. I hope you find a little bit of hope and inspiration in there. We know it's frustrating, but we are here for you to help you. Awesome. Oh my gosh, you guys got some great questions. All right, very next one. How much can my sleeve support with food 7 months post-op?
In terms of, I guess this is supporting in terms of portion sizes and things like that.
Yeah, that's what I would assume.
So everyone's sleeve is a little bit different. Everyone sort of feels it a little bit differently. I always tell people in the beginning, the first couple weeks of surgery, your sleeve, screams at you afterwards. After that, and it sort of talks at you. And then, later on, it just sort of whispers at you. It's always there, but the sensation of what you're feeling and how tight and everything like that, it goes away a little bit over time. Also, as that swelling goes down over time, the amount of food that we need to take in increases a little bit. It's going to be a little bit different for everyone, but about 7 months into the journey, at this point, the swelling, of course, has pretty much subsided. And at this point, your sleeve isn't going to be screaming at you anymore. It's probably going to be just more like talking to you in terms of that restriction and that portion control. I would say most people at this point are probably eating anywhere from 4 to 6 ounces at a time is a generalized ballpark. Some people can do a little bit more. Some people can do a little bit less. But 4 to 6 ounces at a time seems to be a general ballpark. And that's kind of the ballpark that we used even just going forward for a mature sort of bariatric surgery.
Awesome. I know when I was maybe 6 months post-op, I realized that I was eating a whole lot more and I absolutely panicked. I just lost my mind because I was like, oh my gosh, I've done something wrong. But no, I was healed and my body, I was starting to get in touch again with those hunger signals. And because I had the sleeve as well, right? Your stomach still expands and contracts when you consume food. And some days you are just going to be hungrier and need more nutrition than other days. So because on some days you can eat more, on some days you can eat less, it doesn't mean you're doing anything wrong. What it really means is that your body is kind of starting to function as it's designed. It's not necessarily a moment to panic.
Right. And I think the biggest important thing that we talk about when we talk about, how much food can my sleeve support? Well, it can also support a lot of protein. So making sure we get our protein in. Now that we're 7 months into it, I'm sure protein goes down a lot easier.
Yeah.
Really hitting those 60, 70 grams of protein a day.
Yep,
at
yep,
least.
yep. And the person that asked this question, Chris, kind of clarified a little bit. He said, I'm 61 years old, down 119 since VSG in September of 2024. I'm not overindulging, but find that I can eat 8 ounces at a meal. I'm afraid it's too much. My current doctor's not available to ask.
That's actually probably pretty okay at this point. I mean, again, everyone's going to feel sensations a little bit differently.
Hmm.
8 ounces, 6 ounces, 4 ounces, it's about the same, especially if we take into, maybe if you're eating 8 ounces, you're not having to eat as many meals throughout the day, right? You can sort of eat a little bit more like the three largish or three medium-sized meals throughout the day. So at the end of the day, it's probably about the same. Again, everyone's sleep is a little bit different. Everyone feels a little bit differently. It's clearly been working for this person very, very well. Congratulations, Christopher. I mean, wow, that you're down 120 pounds, hopefully feeling excellent. So clearly, what you're doing is right. So I would tell you, trust yourself. You're doing it right.
Yep. Awesome. 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 And I think that helps. He says, "Whew, thank you," in the comments. So awesome. Perfect. Great question. It's something we all panic about. Like, I swear that is a stop on everybody's bariatric journey. Am I eating too much? Am I eating too less? You just don't know what to do because for so long you just couldn't trust your hunger or you were just
Right.
constantly hungry. I mean, it's a minefield, so to speak, but getting it figured out. Awesome. Okay, next question. What advice would you give to someone who had VSG surgery, who is almost 5 years post-op and just did her first shot of Zepbound yesterday?
So this is a very, very common question, or this is a very, very common scenario. And the first thing I think I want to make sure this person knows is this is not a sign of failure. This is not a sign that you failed your sleeve, but your sleeve failed you, right? This is a sign of us continuing our fight against this disease, this chronic disease of obesity. And sometimes, like you mentioned, April, sometimes additional treatments are needed. And
Mhm.
Zepbound, Wegovy, these GLP1 medications are all part of that spectrum of additional treatments. So if we are 5 years now after our sleeve gastrectomy and we're thinking about using some of these metabolic medications, it's probably just try to get some weight off, or we've had a little bit of weight reoccurrence, which again is just part of the disease
Mhm.
process. So I think it's making sure that we have that correct mindset, that we haven't failed in any way. I think it's one of the most important things. And then of course, once we get these medications going, really sort of just being aware of how it makes us feel, some of the changes in some of our habits and food choices that it makes us experience. Really try to utilize these medications as well as possible, trying to get into an exercise routine if possible at this time, doing everything we can, because the goal is eventually to try to get these medications off, right?
Mhm.
So just really being aware of all these changes that these medications are causing. Use these medications for 6 months, 8 months, a year, two, however long you need, but with the goal of eventually taking these medications off, and then hopefully allowing our sort of underlying surgery, which is the sleeve in this case, to sort of let us continue that lower weight.
Mhm. I'm going to echo exactly what you just said. There is no shame in starting a GLP-1 medication before or after bariatric surgery. One of our most recent podcast episodes was with one of your peers, Dr. Kukrasia. And in that episode, he just very clearly says, look, obesity is a lifelong, chronic, and progressive disease. And that progressive word is, I think, something that we leave out often. But there is no cure for obesity. Bariatric surgery helps us treat the disease, but sometimes the disease continues to progress, and that just means we need to onboard more treatment. It's not a issue, it is a disease issue, and the disease just progresses throughout its life. Just as you get older, the disease is going to kind of travel with you. So knowing that there are other treatment modalities out there, extremely important, and it's awesome that you have tapped into this for sure. Dr. Chen, are there things that bariatric patients who are on these types of medications, do they really need to pay attention to? Like we keep hearing protein, hydration, vitamins. Is that like an absolute non-negotiable when you're on these types of medications?
I mean, it's almost like going back to the first day after your sleeve, right? When you're just learning your sleeve and how that felt, right? These medications make you feel very, very similar to that. So yes, so I mean, adopting a lot of, really paying close attention to a lot of the great habits that we have already, the focus on the protein, the focus on the vitamins, the focus on the hydration, the focus on the exercise. These are all things that we have already sort of, brought into our lives, and just making sure that we particularly focus on them. Bariatric patients do very well with these GLP-1 medications because they have all these tools already in place. The
Hmm.
people who actually don't do so well with these medications who have some issues are the people non-bariatric patients because they don't know
Yeah.
about the protein. They don't know about the lean muscle mass loss if we don't get the protein in. And so they sort of run into trouble. They don't take the vitamins already. So you already have a lot of tools in place as a bariatric patient, just making sure that we continue to utilize all those tools.
Awesome. Yep. Well, you heard it. You heard it right from Dr. Chen. Nice work on continuing to treat your disease, and absolutely partner with your primary care or your bariatric physician as you continue to take those medications. It's really important that you are right staying in contact with that person. Awesome. Oh my gosh. Okay, next question from Kate. I'm struggling with insomnia. Oh, my friend, me too. So tired. I'm not exercising, but I'm sticking to a meal plan. Put on weight 2 kilograms in 2 weeks. 3 years post-op. Should I worry?
At this point, it's 2 kilograms in 2 weeks. There's going to be little fluctuations here and there. This person clearly is very, very in tune to their body, is very, tracking their weight, is very honest with themselves. I would say at this point, just kind of continue just tracking things. I mean, dealing with the insomnia, seeing if we can figure out any ways to kind of, resolve that. Trying to get some exercise back into their lives once the fatigue sort of wears away,
Hmm.
and just kind of keeping a close eye on things. If that 2 pounds in 2 weeks and another two, we have another two in another 2 weeks and another two after that, then I think that's something that we need to sort of address. In which case, talking to your bariatric surgeon or your medical team might be something to talk about in terms of are there other things that we could be working up and
Hmm.
helping you out with.
Hmm. And Kate, if you are a woman or if you have internal female organs, something that I recently was diagnosed with, and many of you know this, is I'm postmenopausal, which is bananas because I'm 44. But one of my really big, like, telltale aha for me that I should go in and get my hormones tested is my insomnia went from bad to really bad in a kind of a short amount of time, and it impacted my weight, it impacted my mood, it did all of this stuff. So sometimes things that we think are related to obesity are actually related to other factors, other things that are going on in our body. So do not be afraid to reach out to a female doctor, to an OB, right, and maybe start having that conversation about hormones and the changes that women go through kind of in this middle stage of life. You might be surprised. I was absolutely shocked when they told me I was postmenopausal at 44. That's really early. And since then, I've started HRT, and I have also started a sleep medication. And I can tell you it is making a difference. I'm still exhausted, but I'm sleeping more, and I can just feel it. My body is kind of recharging.
Mhm.
And it's just a part of it. So don't stop advocating for yourself. And exactly what Dr. Chen said, this could just be a blip, or it could be a little indication that something else is changing in our life. So don't be afraid to reach out. Awesome. Oh my gosh, you guys. Okay, next question. You guys are on
Bring
fire
it
tonight.
on. Bring
I
it
know.
on.
This is so good. Christine said, I'm coming up on 1 year post-op. I'm delighted with my
Congratulations.
I know. She says, I'm delighted with my success, and I've dropped over 200 pounds, but I still have a BMI of 40.
Mhm.
I keep hearing all the results come in the first 6 to 12 months. Is that true? What can I expect in year two?
So I think everyone's metabolism is going to be different. Everyone's going to respond differently to surgery, and the rate of weight loss is always going to be different for each person. I always tell patients, on average, people can lose weight for up to 2 years after
Mhm.
surgery, and that's on average, right? And so that means some people can lose most of the weight very quickly in the first year or two, in the first 6 months to a year, or additionally, some people can continue to lose weight after the 2 years,
Mhm.
right? On average, it takes about 2 years for someone to reach their sort of new stable weight. And so with this, I mean, we lost 200 pounds in year one. That is excellent. You might be someone who loses weight very quickly in the first year. I'll say over the next couple months, you'll probably still have continued weight loss. It might just be at a slower pace as we just sort of approach our goal. But there's definitely going to be some more results to we'll have more results. And like I said, it can take up to 2 years for someone to reach their new sort of stable plateau weight.
Mhm. My lowest weight was achieved in year four, and that was after really focusing on my nutrition. It was a refocus on movement. It was a refocus on all of the pillars, and starting a GLP-1 medication. And that came in year four, and I've been able to maintain some of that. I have regained some weight after I did stop my GLP-1, But it's okay. I'm still at a low weight. I'm still metabolically well, right? There's things that are happening. But yeah, right. Just as what you said, Dr. Chen, this time that we can really maximize is really years, right? 0 to 2. That is the sweet spot. But the really wonderful thing about being a bariatric patient is you have this tool for life.
Mm-hmm.
And there are going to be things that are going to come along in this journey that you're not going to figure out or even face until years 3, 4, 5, 6, 7, 10. So you absolutely have your entire life to understand what this disease is all about, how it impacts you, and not be quite so panicked about losing all your weight within a specific amount of time. Because, like the disease, it's lifelong and chronic. You have your life to really figure this out.
Right. It just the tool just doesn't stop working one day at the end of the 1 year. It just stop. It keeps on going. Um, as long as you stay focused on it, which this person clearly is, we're going to see awesome things in year
Yep.
two.
Awesome. Awesome, awesome. Ooh, another really great question from Chris. How long after sleeve would you recommend a single switch? I still have another 85 to 90 pounds to go. How difficult is the single switch duodenal surgery?
What you're talking about here, I'm sure, is a SADS operation, which is, again, one of my favorite topics to talk about. The timing of revision operations is, I think, unique to each person, right? And I think this just sort of piggybacks off the last question that we just got, right? So, with a sleeve, I want to see everything that we get from that sleeve, right? I want to see us at a stable weight. So whatever that point is, a year, 2 years, I want us to see us at a stable weight. If that weight is above our sort of goals, and when I say goals, I mean our overall health goals, not just a number in our head, but like a goal that we need to have for health reasons, to make sure the diabetes is gone, to make sure the sleep apnea, the GERD, and all those things are gone. If that weight is above that level, and we are still struggling to get that weight off, and it has not come off with the sleeve itself, we can talk about doing a revision option. We could talk about, do we need to treat this in cases, or do we get treated with surgery? And if we take a sleeve and make it into a more powerful metabolic operation, my preferred operation was SADS operation. It's a very, very safe operation done in controlled settings. It's I don't know how to explain difficult. There is difficulty to the surgery, but
Mhm.
it's a safe surgery. We do it very, very well these days. Utilize a lot of the robotic techniques to do the operation in a very, very safe fashion, and I say patients do very, very well with it. Particularly patients who go from a sleeve to a SADS operation, they'll typically say that the conversion operation, the revision option, revision surgery actually went smoother, or the recovery was a little bit faster the second time around than the
Mhm.
first time with the sleeve.
I've heard that from members of the Berry Nation community. We have quite a few revisionists, as we like to
Yes,
call them, in Berry Nation, and they are oftentimes really happily surprised at the recovery process from the second surgery. Nobody usually wants to go through a second or third bariatric procedure, but we do what we have to do to treat the disease and maintain our health. So yeah, what awesome. Christopher said, thank you so much. Very helpful.
and
Awesome.
yeah, exactly. It's not like Jonathan said. It's not a chat with me. Like we're talking about the gut microbiome or duodenal switch. Two
Nope,
of my
nope.
favorite topics, and
Exactly.
important topics at that.
Everybody check your bingo card. Check your chat with Chen bingo card.
Somehow it always comes up, and I love it.
It's because, like, literally, when these things happen, your entire face changes. You just become so animated and happy. You're so joyful to talk
Yeah,
about these things because you absolutely love them. Yeah, you see the power of them. You see the power.
exactly.
Oh, awesome. Oh, great question from our friend Christine. Wasn't VSG designed to be a two-step operation? Was the insurance companies that set the standard if it was being one and done? So I think what she's asking is, like, for people who have a larger amount of weight to lose, right? Is VSG like the first surgery to get you more stable and then you progress to a revisional surgery?
So this is a really good question in terms of this person's rather history of bariatric surgery. So the vertical sleeve gastrectomy, yes, it was originally designed, or originally came to being, as the first stage of a duodenal switch operation.
Oh,
So back in the 90s, all we were really doing, there was there were a couple other bariatric operations available, but the two bigger ones were either gastric bypass or duodenal switch. And the first portion of the duodenal switch was the sleeve gastrectomy. We were doing duodenal switch operations back then, open techniques, much more difficult. We were doing it on, people with a BMI 80s and 90s. And sometimes we couldn't do the whole operation all at once.
oh,
So we would just do the sleeve
oh,
portion and inadvertently not planning on
oh.
doing it, or just, that's just what we could do safely. And we realized that people with a sleeve gastrectomy would also lose weight. That just doing the sleeve itself would help them lose weight for these individuals, potentially not all the weight that they needed, but definitely some weight that we could return back later and do the second portion of the operation, the duodenal switch operation. So that's how the sleeve gastrectomy was born, as essentially the first stage of the duodenal switch. Later on, 2010s, 2000, in the 2000s, we started thinking, well, can we just do the sleeve gastrectomy only as a standalone operation? And we found out that absolutely yes, for the right individual, the sleeve gastrectomy is an excellent operation, and it's an excellent operation for many, many people, particularly because it doesn't involve the rerouting of the small intestines and things like that. And so people would also lose weight with the sleeve gastrectomy itself, and therefore that operation was born.
Wow. And I would imagine too, as technology has improved, right, your ability to perform kind of the more technical surgeries has also improved, right? So you have a shorter surgery time, you're able to more effectively perform that surgery, right? You have improved outcomes. So just kind of as technology progresses, you're able to apply that technology to people battling the disease for improved outcomes all across the board.
Right. So with robotic technology now, especially, the need or the absolute need to do a two-stage operation like that for someone with a BMI 80, 90, 100 as a two-stage operation, we can sometimes now just do it as a one-stage operation with
Wow.
the aid of the robotic platform that does make that operation much more possible than than it ever was. But that's still how the sleeve was born. It does work. It works excellent for many, many of our patients. Insurance companies, I think the last one was it the insurance companies that set the standard if it being one and done? Well, I think that also addresses another question that some insurance companies only allow us to have one bariatric surgery a lifetime.
That's me.
I think that's a separate question, and that is something that is entirely set by insurance companies. That is something that's entirely bogus. That it's a horrible proposition put up by insurance companies for the only reason of trying to save money, and for the only reason of insurance companies seeing this as someone's fault, right? It's like, you failed your surgery, therefore you don't get it again. That if you don't reach your goals, this is not the disease's fault. This must be your fault, which is absolutely bogus. We know that, right?
Yep.
You don't give a cancer patient one operation.
Correct. Yeah. Or one shot at chemo or one shot at radiation. No, unheard of. Or like a heart patient. No. Yeah.
But for this disease, somehow the insurance companies have the same stigma that society has, that this is someone's fault, right? So the insurance companies here come in like, oh, we're going to be your savior. We're going to give you your one shot. And if you fail, that's your fault. That's totally wrong.
Agreed. I have the honor of sitting on the ASMBS Access to Care Committee, and every month I go to that meeting diligently. And to hear the frustration and anger in that Zoom room is palpable. And it is so inspiring, though, to hear what all of those experts in that room are doing to improve access to care for people. So they literally have a list of these insurance companies that have these one and done policies, and it is their mission to kind of go after them, to push them on why you are so limiting the access to care for people who clearly continue to suffer from a disease. So I know it's a problem. It's inspiring to be in that meeting with them, to hear what they're doing about it. But oh my gosh, an endless fight. And when I have been experiencing my most recent round of weight reoccurrence, the first phone call I made was to my insurance company, and I was like, hey, so what are my other treatment options for the disease? Nothing.
Yeah.
No medication, no secondary surgery, no nutrition, nothing. Like literally absolutely no other form of coverage. And to say I was disappointed is an understatement.
It's just a horrible thing.
Yeah.
I mean, this just speaks to, it's just so much of the pain that our patients have to go through because of the way that this disease, the weight that they carry, the metabolic issues are not being treated as a disease by society, by insurance companies. This is our biggest thing that we have to fight.
Our biggest thing. Yep. Agreed. Okay, Dr. Chen, I know we're almost at time, but we have 4 other questions
Let's
that
do
came in.
Rapid fire. We're doing quick.
Okay, you're the best. So this one question I'm going to ask you came in from a member of the Berry Nation community. And if you guys don't know, we are practice partners with Dr. Chen and Dr. Joe in Texas. So if you would like to join Berry Nation and have this kind of support every single day in our private community, you can comment Texas down below and we'll send you links so you can learn all about it. Or you can just send us a DM because you get a discounted rate in the Berry Nation. So this question came from a member of our community. They have recently had surgery. They had no gallbladder issues before surgery, but recently found out that they have a lot of sludge and stones in their gallbladder. And their question was, is it normal and what would be causing that?
So that's actually, so gallbladder issues after bariatric surgery is a very, very common thing. Essentially, the weight loss that you get from bariatric surgery can cause gallbladder disease. And
Okay.
so it can lead to the stones and the sludge that you have in your gallbladder. If
Oh,
you're having,
so
if you're having symptoms from this, or having right upper quadrant pain, pain underneath your breastbone, some vague nausea symptoms, my recommendation is then to talk to a surgeon and talk about getting your gallbladder taken out before it becomes more of an issue. It's very,
okay.
very common to have gallbladder issues after bariatric surgery.
Okay. And just to clarify for my own learning, and obviously I'm going to pass this information on to our member as well. So the rapid weight loss can cause gallbladder issues.
Exactly.
Okay.
Cause gallbladder issues or exacerbate gallbladder issues. If you've had pre-existing stones in your gallbladder, because people walk around with stones in a gallbladder all the
Yeah.
time, and it
Yeah.
don't cause you issues,
Okay.
right? We don't look for that. Just having stones in your gallbladder doesn't cause problems, but those stones can lead to symptoms. And if you've had stones in your gallbladder beforehand, then you undergo bariatric surgery, you lose the weight. Those stones can most likely now become problematic,
Oh,
and therefore we're also talking about getting getting your gallbladder taken out.
okay. Awesome. Wonderful. Thank you. I'll pass that on to our member. Great. Wonderful. Okay. Next question. And one of our very close friends, 13 years post-op from VSG this year. Grateful
13.
to have access. I know 13, 1-3, 1-3. And she is a fierce obesity advocate and warrior. So grateful to have access to Wegovy right now and have lost 65 pounds of regain, weight recurrence with it. With the pharmaceutical landscape as it is, do you think access to these GLP-1s for weight loss is going to increase, or do we need to worry about losing access and maintenance? Great question.
So yeah, I don't have a good answer for this. I mean, I think it's going to be challenging, and that's what I always warn my patients with, starting these medications. I don't know what the future is.
Yeah.
Right now, I mean, especially if this person is getting it through compounding pharmacies and things like that, there's definitely been a big push to kind of limit access to these medications through the compounding pharmacies. Of course, longer term, Wegovy, these big pharma companies are always going to be making these medications. It's just whether these insurance companies are going to be wanting to cover these medications.
Hmm.
And there's a part of me that says that the insurance companies are eventually going to start looking at these medications just the way they look at surgery, right? For this disease of obesity. For the longest time, insurance companies have always limited surgery for the disease of obesity, and I have a feeling that they're going to probably be doing that too to these medications, just because the insurance companies are in the business of business, right? They're in the business of making
Yeah.
money, and these medications, particularly if given for lifelong, can be fairly expensive for these insurance companies.
Yes. And the landscape is changing like minute to minute. Again, last week in that access to care committee call, this was a big topic of conversation, right? How can we advocate for just more treatment options for our patients? And then today I was reading some news articles about an executive order that I think was signed or maybe not, but it was about lowering the drug prices. So it was like the people in the United States shouldn't pay more than people in other similar countries. It was something like that. I'm absolutely butchering it, but right. So that's on the table now. So, right, the federal government maybe can or can't force these companies to bring the cost down, but then you go back to the insurance companies and how that plays into it. Like nobody, it's just like,
It's
what?
it, it is complicated, and so yeah, so especially when I meet patients for the very first time, and we're talking about, do we want to try to treat this by the medication route, or do we want to treat it by the surgical route?
Yeah.
I always warn patients, yes, we could try the medication route, but we have to acknowledge that these are medications, and we are always going to be having this in the back of our minds,
Hmm.
access to these medications. Luckily, with surgery, that sort of sticks with us. Those changes are a lot more permanent or a lot
Hmm.
more durable,
Hmm.
and so that can carry us
Yeah.
forward.
Yes. And as a patient, it is just so frustrating to live with a recurrence of your disease, and even more frustrating to know that the things out there that can help you could be financially out of reach for you. So on one hand, it's great that, the government and all these people are advocating to make that more accessible, right? But then the thought that always pops into my head is, okay, great. So if these medications became made available, wonderful. But next year, the year after that, there's just more medications coming down the pipeline. And then it's like, oh my gosh, well, now do I need to switch to this one? And is this one going to be available? It's like this constant, like chasing your tail scenario. And as a patient, you just get exhausted
Right.
by it all.
Right. You do. And it's we don't know what the future holds with these medications.
Yeah.
I mean, I absolutely think that these medications are important. I do think that they play a very valuable role in
Yeah.
society against obesity. I
Mhm.
just don't know what the environment looks like
Yeah.
down the line.
Yep. And the other thing I want to call out, because what you said is so powerful. If you are watching this and you're already a bariatric patient, or you're watching this and you're thinking about going on a medication or having surgery and you just don't know what to do, I think it is really important that we start telling ourselves, I just need to make an appointment with an obesity medicine specialist to start the conversation. Don't look at Dr. Chen. Don't look at Dr. Joe. Don't look at any of our practice partners who are surgeons and think they only perform surgery. They are obesity medicine specialists, and they want to have a conversation with you about how the disease is impacting your life. Surgery might not be the best option for
Right.
you now or ever. But if you don't have that conversation with a qualified obesity medicine specialist, you are going to keep spinning your wheels in diets and trying things. I think it's important that we kind of make this shift when we're talking about treating obesity. We want people to access treatment, period. Whatever that treatment is right for you, is the direction that you need to go. But if you're not even having that conversation because you're scared that surgery is your only
Right.
option, it's not. There are so many things out there that you can tap into. But if you don't have the conversation in the first place, you're going to miss out perhaps on your ability to treat this disease in meaningful ways. You just have to book that appointment. You have to
Please.
book that consultation.
And I also say that you should book it actually with a surgeon. Just because, like you said, April, just because a patient comes to me, you don't have to do surgery, right? And if
Yeah.
you come to me, I don't want to do surgery at all. I'm not going to push that.
Yeah.
But you do want to go to someone who offers a full complement of treatment options. I'm not limited in what I can treat a patient with, right? If
Mhm.
I'm not limited in what I can treat a patient with, I can offer them medications if that's the best bet. Also, I can talk to them about surgery and what that sort of looks like. If you go to someone who doesn't do surgery, then all they can do is medications. And whether you're the best fit for medications or not, they don't have anything else to compare that to. So
Yes.
you should go to a carpenter that has more things than just a hammer. Just
Yes.
I've used that analogy beforehand. And you should also go to a physician or a doctor who has more, has a full complement of tools available to them.
Yep. I was literally we mind melded, because it was exactly what I was going to say. We've been in this house almost 6 years now. We have this beautiful home, and all of a sudden I'm starting to notice just little things, right? There's crack in the ground, or there's little separations here. There's just little things. And when I was thinking about, like, okay, I should call somebody for drywall, maybe I need to call somebody for tile. I was going through this list and I was like, or I just call my builder and say, hey, I'm noticing these things. Do you have a general handyman that can help me with all of these things? It's the exact same thing when it comes to obesity care. Who is the obesity handyman or handy woman that I can go to help me tackle this?
Right.
So, I love it. Freaking awesome. Fantastic. All right. Okay. Two more, I promise.
Let's do it.
Let's do it. 5 weeks post-op, Sadie S. Done by you, Dr. Chen.
Hey, hey. Nice to see you.
So they said, currently struggling when switching off a mostly liquid diet to soft actual food. Any advice? And Mel, see, if you're still watching this, can you give us a little bit more specific? What is the struggle? Is it just like eating food again? Is it a texture thing? Is it, right, getting food down? But what would your suggestion be, Dr. Chen?
A lot of this is just just figuring out the diet that works for us, right? Because now, especially our anatomies are very, very different now, right? Food sits very, very differently. And for any patient who's in 5 weeks after any bariatric operation, we can talk a lot about the sort of changing taste buds, the change, food aversions. Food just doesn't taste the same, and we no longer also have the same urges to eat,
Mm-hmm.
right? We no longer have the same hunger cues.
Mm-hmm.
So it does become a little bit of a challenge. And the best advice I can offer someone is give yourself some space and grace. right? Give yourself some time. Work, of course, on the easy stuff, right? Work on, chicken, ground chicken, ground turkey, not heavily seasoned, certainly not a lot of sauce, things like that. Lighter stuff, well cooked vegetables, super soft things, some lighter fruits, whatever your body sort of likes. Nothing too heavy. Try to avoid eating out where you're, confronted with a menu and uncertain preparations, and just kind of taking it slow.
Yeah. It it can be overwhelming and it can be a little bit scary when you're transitioning back to whole food after surgery. And I appreciate like what you said. Really trust yourself in this moment. I know that's hard to do, but you might not want to eat certain foods or you might really be struggling with that. That's kind of normal. At about 6, 7, 8 weeks, I had this total breakup moment with food. I was so over it. It was overwhelming. I didn't want to eat anymore. I was like, nope, I'm going to live off protein shakes for the rest of my life. And I just literally took a break from food for a while. I obviously have come around since then. I've reestablished a relationship with food, which I'm very thankful for. But feeling a little friction there where you're at is kind of normal for us in our bariatric life. So thank you, Dr. Chen, for just recommending space and grace.
Space and grace.
Awesome. All right. Very last question for tonight. Gorgeous green-eyed monster. What brand of probiotics do you recommend?
Actually, don't have a specific brand actually of probiotics. I just recommend. I think probiotics are a great thing. Well, there it goes. Gut microbiome. We were waiting to lead up into it. Boom, there it is. The gut microbiome. Boom. We almost went the whole time without actually specifically mentioning it. Then we just got it in the last second. So the probiotics I think are excellent, particularly for gut microbiome health. And so I don't have a specific brand of them that I enjoy that I particularly like. I just say any kind of probiotic is great. Also, fiber is also really good for our gut microbiome, so making sure that we get our fiber in. Those are
Yep.
all good things for our gut microbiome, and anything that's good for the gut microbiome is good for us.
There you go. We checked both things off of our Dr. Chen bingo card tonight. Gut microbiome and saying yes. I
Exactly.
mean, that's
Exactly.
well, that's how you know it's been a good night. Oh my goodness. Well, friends, thank you for those amazing questions. This live will actually be available on our YouTube, oh my gosh, on our Instagram channel. So if you found this helpful, you can go back and rewatch it. And please also share it on your own social media pages so other people know that this amazing resource exists, because we covered a lot of things tonight. Dr. Chen, I always like to give you the microphone to kind of end it. What are you hoping people are leaving this live with tonight?
I hope people leave. I hope people leave with this, that there's a sense of community out there. And I think this is what's really, really important. Whether you find that community through Berry Nation, which I hope you do, or you find that community through your local Facebook groups or your other patient support groups, I just want to make sure that people, don't feel alone out there, because I think for so long people can feel like they're trying to do this in hiding, right? That bariatric surgery is something that they need to hide from their family or their friends, that they need to kind of sneak this through. Um, that's wrong, right? We should find support. This is a tough thing that we're doing. We're trying to change a lot of ourselves, and we need all the support that we can. And so, search for that support.
Oh, thank you for saying that. This disease of obesity thrives in isolation. It really does. And if we continue to isolate after surgery, it can kind of win more of those battles. But when you tap into community, it really shrivels. There's not a lot of answers that obesity can throw back at a kind and caring, compassionate community that knows what this feels like and looks like to fight this disease of obesity. So it's been the thing for me. I know it's been the thing for hundreds of people who are members of our community, and hopefully it will be something that you tap into as well tonight if you're watching this live. So thank you so much. Thank you, Dr. Chen, for your time tonight. This was
I can't
rad.
wait. Can't wait to see you soon. We gotta do this again.
Oh yeah, it's happening in the nation coming up
Yep.
later on this month. Awesome, friends. Thank you, Dr. Chen. Thank you all for watching live. We hope you enjoyed it.
I'll see
All right, friends.
you guys.
See you soon. Bye.